A miracle he performed. I couldn't walk. He'll tell he had a practically lift me in his machine. I walked down the steps, went shopping and all. I got in trouble for doing it, but what a guy.
Well,
You're terrific. Wait till I go to the football banquet on the 31st. I'll be doing a commercial for you. There'll be 300 people listening to me. Now, what do you want to do today?
Well, first I want to talk about
Go ahead.
what's going on since Joe had his last treatment. As you noticed on the last video, you could probably see how zealous, perhaps overzealous, Joe might have been after he had his pain relief. And you could tell by the fact that he's moving his legs around and jumping around. He's a very active kind of guy, and he likes to move around. So when pain gets him, it really gets him. When he feels no pain, then he takes off again. Like, how would you make the analogy? Like somebody's trying to run and you're holding him back.
It was amazing. I got to tell you,
Yeah.
There's one other remarkable thing I want to mention. But last week when I had that very bad attack, I came out of this machine and was able to walk, go down the stairs, do my shopping, things that I was not able to do. I could not walk to get in the machine.
Okay, now this is the thing. This is leading me to my point here. Joe is doing what a lot of patients, not a lot of patients, but quite a few patients do, and that is they become a little overexcited to the point they do too much. I didn't want him going down the steps. When he left here, he went down the steps. I didn't want him going shopping and grocery shopping and lifting bags and all that kind of stuff. He did all of that. And he was involved in a lot of activities on the very day that he came out of this pain, meaning he was a bit overconfident, and he had a bit of a relapse.
I want to make a point here that's very, very important.
All right.
For years, my thighs have been absolutely dead, whether it be from the effects from the diabetes that is now gone away since they took me out. I have a complicated medical history, but whether it was the neuropathy or was it the herniated bulging disc in my back, I don't know. But I have feeling in my thighs. Now my back is completely, I'm 100%. I feel fine. I was surprised that Mitch wants to put me in the rack, but whatever he says I'll do. This is the fastest recovery time I've ever had. When I said earlier, I had to be lifted into the machine and walked out. And the guy did overdo it. Mitch is right, but we have a daily life. My next day.
Well, I wouldn't expect this to come back that quickly if it was related to your neuropathy.
Okay.
Okay, so perhaps
It wasn't a disc.
Perhaps.
Yeah.
I mean, because that would just disappear.
This feels so strange that I can feel my thighs. I mean, it's like I have new circulation.
But the point I wanted to make here was that it's very important to tell the patients to not overdo it once they feel better, and it's very difficult sometimes to prevent that from happening. So as a result, he did have a bit of a relapse, but he recovered from it quickly, and now he's feeling good. He may end up readjusting the lens.
I can't get over that. I feel the thighs, which I tell it is just unbelievable. I mean, the only remedy in the past when this ever happened to me would have to go get an injection that would deaden everything. And this is just amazing. And you know, you're right, it wasn't a neuropathy because the discomfort lessened and lessened. In fact, yesterday it was down to minuscule, less than a 1 on a scale of 1 to 10, and now it's completely nothing. And the day before it was a 1.5, 2. It was, do you understand what I'm saying?
Yeah, I got you.
And it just, if I probably injured something in there, and it was a simple task of just putting a sock on. So, I mean, I didn't injure it by lifting or, you know, anything like that.
Hold on, I got a question.
Right. There's a lot of people around there walking around that are suffering that needs this machine. Whoever invented this, it's like Louis Pasteur with the sulfa drug. Come on.
Back project.
Back project. Buy stock in back project.
Well, everybody's pain is a little different, and the situation's a little different. And the thing that people, like I have another patient right now who got good results for this. However, he's got a bit of a different problem. And I predicted pretty much what would happen to him He did get pain relief.
Right.
No pain in the leg, no pain in the back, but when he fully extends his spine, he reproduces
Yeah, no,
symptoms.
I'm fine with that.
And that's something that I'm working on him as well. So we have to use other techniques sometimes in combination.
Yeah, of course. Well, the muscles
Sometimes
there.
we don't.
that we-
Sometimes
Yeah,
it's
sure. I felt that I was using muscles after this treatment that I wouldn't normally use. You know, my posture's much better, in my judgment.
Okay, where do you want me to start?
That's nowhere. Right now, I feel terrific.
You don't need any more pressure?
No, I'm wonderful.
All right.